Okay, good afternoon, everyone, and welcome. Before starting, just a quick logistical note. Please write your question and comments in the chat. We'll address them later during the session, coordinated by Milka, when the discussion will be open to all of you. And now let's truly begin our roundtable together. Good afternoon and a very warm welcome on behalf of the European Public Health Alliance and the International Society of Doctors for the Environment. My name is Paolo Lauriola. I serve as president of IFA, and I am part of ISDE Italy, where we work at the intersection of public health, environment, and policy. Today, Roundtable, Crises, Cuts, and Civil Society, Reclaiming Public Health Leadership in Europe, could not be more timely. Civil society organizations are the connective tissue of public health. They link institutions and communities, give voice to those most affected, and sustain trust when systems are under strain. Yet they are under threat. In Europe, funding cuts are eroding the organization that helped us through COVID-19, climate-related emergency, and social crisis. The paradox is striking. At the moment, we most need a strong civil society. Its space and resources are shrinking. Our goal today is to highlight why civil society matters for health and democracy, what is at risk if it weakens, and how we can move together from describing the problem to shaping solutions. To set the tone, we are honored to hear from the WHO Regional Director for Europe, Dr. Hans Kluge, whose leadership has consistently championed collaboration between WHO, member state, and civil society. He was asked the same two questions that we are going to address today. Let's hear him.
Coming at the start of my career from civil society myself, Message of Frontier, it's very clear for me. It's not possible to achieve health equity, universal health coverage, without civil society, and in many roles. One is to hold governments accountable when they drift a little bit away from what we agreed universally, for example, on the values. Number two is also in implementing and delivering political commitments, basically to reach the unreached. When I was working in civil society, then it was clear that we were able to reach the people, what I call the last mile. And this is something that we have to understand, very good collaborating between, for example, WHO and civil society. In Myanmar, under the military contact, WHO was developing the guidelines, MSF civil society was delivering the medicine, but they needed the guidelines. So we need to stand together. It's not possible without civil society.
Anyway, thank you. Thanks to Dr. Hugh Kluge, very, very good. And now let's move to the voices of civil society itself. Those who live these realities daily. We have asked each of the speakers to reflect on two key questions. What is the critical added value of civil society for public health and health system in Europe? Second, what are the risks if health and civil society continue to be defunded? Taken together, this reflection should form a mosaic of perspectives from patients to academia, from environmental advocacy to global networks. And then we move to the speakers. The first is Valentina Stramiello of the European Patients Forum. Valentina has long been the voice of patients across Europe. From your perspective, what unique contribution do patient-led organizations make to health policy and systems? And what happens when that voice is weakened by lack of support? Please, Valentina.
Thank you, Paolo, for the kind invitations. So I can go quite straight to the point. Patient-led organizations are organizations that not only bring the voice of patients, but they do it by synthesizing the patient perspective in a unique voice. So we do an effort in ensuring that the perspective we bring is legitimate and representative as far as possible. Of course, this requires an effort from our side to make sure that the diversity, equity, and inclusion are ensured in our communities. We bring a unique perspective because we are used to say patients are the ones living with lived experience of chronic conditions or even degenerating conditions. And this is a unique space that cannot be represented by any other stakeholder. So it's a very unique perspective. When funding lacks or gets reduced, of course, the risk is that we may in a way, be perceived as losing our independence. Even though we always make an effort to ensure diversity of funding, lack of public funding, of course, may lead to the perception that our perspectives are not independent, that we are always accused of a risk of bias. And the lack of public funding, of course, may reinforce that perspective, unfortunately, even though we have always made an effort to ensure diversity of funding. Of course, it gives also another message. Not having access to public funds gives the message that our perspective are not as needed from decision makers. And the ultimate risk, in my view, is that if we don't have a voice, systems will be designed and maintained without taking into account the perspective of final users. So the risk is not really addressing the needs of the population. Thank you.
Okay, thank you so much, Valentina. Very good contribution. And now I leave the floor to Federica Margheri of the European Health Management Association. Federica, from a health management and governance lens, how does civil society make system more resilient, inclusive, and accountable? And what does Europe stand to lose if these partnerships aren't structurally supported? The floor is yours.
Thank you, Paolo, and thank you to your organization and IFA for the very kind invitation. As you mentioned, I'm here representing the European Health Management Association. We are a membership organization and a civil society organization, and we bring together managers at hospital level and from other care delivery services, researchers and practitioners from across Europe. So speaking from a health management perspective, civil society organizations are definitely an indispensable player because they do ensure alignment among governance, leadership, and community voices. And they have, of course, a unique contribution towards the resilience of the system because civil society enables to connect the system with the people that it serves, so citizens and patients. And when it comes to health managers specifically, I believe that they have even a more important role, which is that they are the ones that turn policies into services. So they are really the one that bridge policy and practice. They are the ones that are able to assess a policy, to inform policymakers of feasibility of their policies, what are the resources that are needed to implement a certain policy, but most importantly, if a policy is actually achieving the expected impact. And so in these sense, health managers really have an essential role because they make sure that policies are not just abstract concept and disconnected from society, but they really respond to the needs of people. And on top of these, organizations like EMA are essential to provide a platform for exchange through all the work that we do on a daily basis, through scientific conferences and events that enable health managers and different health sectors, stakeholders, to ensure that their experience is heard and that their knowledge on the ground is channeled into system-wide learnings. And as we heard from the video of Dr. Kluge, it's essential to maintain decision makers accountable towards the citizens and the patients for which policies are designed for. And so in recent crises, the pandemic, but also the climate crisis and geopolitical instability, we have seen that health management matters. We've seen that the managerial dimension, so really the know-how of how the system works in practice, can disappear from the debate if civil society is not properly funded. And this therefore means that we have less preparedness, we have less accountability, and therefore we have less resilient health systems. And to conclude, because now the new narrative is around competitiveness, I think it's always important to mention that funding civil society is not a luxury and is not a waste of money. It is actually an investment in the infrastructure of resilience, of accountability, and of trust.
Thank you so much. Thank you so much, Federica, for your contribution. And now I call Anne Stauffer from the Health and Environment Alliance. And civil society often brings the environment and climate squarely into the public health debate. What would Europe lose in its ability to tackle upstream health threats if organizations like HEAL are underfunded or sidelined? And the floor is yours.
Thank you very much, Paolo, and thank you very much to Aoife and Iste for inviting me to participate in this exchange here today, which is a really important exchange. So before I want to talk about the role of HEAL and what would be lost. I would like to spend just briefly time on talking about the attacks on civil society and what we're seeing, because I think it's important that we all are aware of the context. So my organization HEAL is an alliance of over 70 member organizations working for better health through a healthy environment, and we're part of one of the environmental NGOs receiving funding under the EU LIFE grant. So I wanted to bring in the perspective here of environmental organizations. And as we are unfortunately, if you want, commemorating when we now have a 1-year anniversary of when these attacks against environmental organizations started. So we have been very much, HEAL and others have been very much at the forefront of what happened. And from my perspective of having worked in Brussels at EU level for 2 decades, this is really an unprecedented attack. We have seen questioning of the funding of NGOs, of environmental NGOs before, but this is really the most vicious of what we're seeing right now. And this is indeed about defunding. This is about questioning the transparency, but it is very much also a campaign to encroach on civic space, and it's also a reputational damage campaign very much, I find. And unfortunately part of a global playbook, I would say, that is really trying to limit civic space. What we're also seeing very much at in member states level, increasingly at member states level in European countries. Indeed, so as I said, environmental NGOs have been at the forefront of attacks, and this comes unfortunately right from the heart of the European Parliament, from the Parliament's Committee on Budgetary Control, where in November last year, the first round of questions emerged. And then throughout this year, we have kind of seen, if you want, phases of these questioning with various exchanges. It was under the guise of transparency that the legitimacy of civil society organizations was questioned. And this very much comes from the far right groups in the European Parliament, but unfortunately, I have to say it is very much enabled by certain parts of the EPP, especially by German EPP, unfortunately. And as I said, it's going through phases. There's been questioning in plenary following the Cont committee. There was an attempt in Envy to stop the next round of the life grant implementation. There was earlier this year there was talk about establishing a Parliament inquiry committee to scrutinize NGO funding. Now, mind you, Parliament committee is kind of a very strong instrument of the Parliament, so that was that luckily in the end didn't come through. But what has now been established is a working group under the Parliament's Committee on Budgetary Control. So the attacks are continuing. I don't have time to go into the narrative, but I invite you all to have a look, because I think it's really important that we're aware of how this is being framed, and also that the narrative keeps changing. It started with transparency. It started around questioning of NGOs are doing lobbying, which is illegal. And we've heard the mention of illegal recently by the health commissioner. And in the case of environmental NGOs, the next round of messaging is now that we have refused to change contracts when we were asked to do so, which is simply, it's an outright lie. So with this attack, there's also a lot of disinformation. I think that's also something to really consider here. Just briefly, key role of NGOs. Other speakers have already highlighted it. And from our perspective, and the perspective of also all the colleagues from the environmental side working on this, we find that civil society engagement is very much at the heart of the European project, and that we make a unique contribution to European democracy and to actually advancing this European idea. In addition, civil society organizations represent the public interest. And since our organizations are, lots of us are active in Brussels, we know that there is really no level playing field when it comes from public interest to vested interest. There are many resource-rich actors, including foreign governments, including corporations, contrasting to us, we often in civil society organizations lack actually the resources to be present in the EU policy deliberations. And we very much see this currently when we have to spend a lot of time on dealing with the attacks and countering the massive disinformation that's going on. And at the same time, there are all these EU policy initiatives, for example, on deregulation, where it's also would be really, really important for us to be present. But we just, we have finite resources and capacity. HEAL and also many other organizations here bring forward independent science. For example, on the health costs of pollution, this is also something that would be lost very much, the independent perspective. And we are independent of political parties and the EU Commission. It's our members who decide the work program. And I'm saying this because this has been another disinformation very much framed that NGOs are, certain parts of the Commission instruct NGOs to do lobbying for them. And this is absolutely not the case. But there's a lot of there's a lot of how do you say, we need to build the capacity of people, because there's a lot of uncertainty around how we as civil society work and operate, and how we get to our work programs. In our case, we've also very much given a voice to those who have been most affected by pollution, to vulnerable groups. We have been, as you have also been, watchdogs on highlighting gaps in EU environmental and climate laws, and we very much hold decision makers to accountable. And these are all key roles of civil society organizations. It's absolutely crucial that we need to continue to be there in the future. We need to have the diverse voices to strengthen the operation and the resilience of European democracy, to protect the European values and the European project itself. And just briefly what needs to happen, because I think it's important that we also talk about what are the next steps in this. Very much want to give the message here that none of us is alone in this. We're in this together. So let's very much work together. Let's work together also across sectors in countering this disinformation and this defunding that is taking place. In mid-November, we're expecting the publication of an EU civil society strategy, which is a key moment for us to highlight the unique role and the important role that civil society holds. There are currently deliberations around the next EU budget. There again, it's very important to see not only the health leadership, but also the leadership of environmental, of civil society organizations to underline how crucial it is to have adequate funding in the next EU budget for exactly the things that we are doing. And also the Parliament's Cont Committee, so the Committee of Budgetary Control, they are looking at the next round of discharging the EU budget for 2024. The rapporteur in this case is a Green rapporteur, so I think it's also very important to contact him and be in touch and also highlight again the importance of civil society engagement for this key process. And I'll stop here and thank you very much again for the opportunity.
Thank you so much, Anne. And now I call for Enrique Barros from the Association of Schools and Public Health in the European region, ASFER. Enrique, ASFER trains the next generation of public health professionals. How does collaboration with civil society enrich that mission? And what risk do you see if civic engagement is left unfunded?
Thank you, Paulo. Thank you very much to ESD and to IFA for this invitation to the Association of Schools of Public Health of the European region. As you know, ASFER is a non-profit membership organization of schools and of programs of public health from across the WHO European region, so it's larger than the EU in its scope of action. It was founded in 1966, so almost 30 years ago, and the association currently has over 130 members in more than 40 countries in Europe, reaching around 200 training sites. ASFER is the key independent European organization dedicated to improving and protecting the public health by strengthening the mission we have, education and training of the public health professionals, both for practice and for research. And building the public health workforce that is so greatly needed as recent emergencies made evident, and that we lack in number and in many places in the depth of quality of preparation. We have been central in supporting the professionalization of the public health workforce in Europe, but mainly in sustaining capacity building in public health. And because especially we try to do it supported by best standards of education and training, scientific research and practice. So that's why, besides all our effort on public health professionalization, and obviously having groups dedicated to undergraduate education, to research capacities, doctoral programs, to the core of training and education, we are very much looking to the everyday life, namely because of the interdisciplinary and transdisciplinary nature of public health. We look at special aspects that might be essential in the preparation of these professionals, but also in bringing together different organizations of civil society. And I can give you some examples like public health emergencies, war and public health, climate and health, and as we heard so much about climate, digital transformation in public health. These are topics that for which the role of a co-creation approach, the role of improving the scope of citizen science and of participatory research are essential, and we tend to see, or should be, a real cement among different organizations. The added value of being one among peers is that we believe that we are bringing trust and legitimacy to the work we are doing. We are also bringing to light the local knowledge and the experience, and making an effort of sharing best practices. We have a real mobilization capacity, as it was quite clear by the action of the association in so many communities during the recent COVID pandemic. And of course, we advocate for innovation, bringing to the next generation, as you said, of public health people, workforce, not only the capacity to respond, but essentially the ability to design the future, and in that sense, bringing sustainability of all this work. The funding is essential because, of course, there's a need for promoting all these actions, and very often, especially because there is also inequalities among the schools, among the programs, among the widths of the NGOs present. We really need institutional funding, as the one that comes or might come from the EU, because we think it enables inclusiveness and also a more democratic approach to the work we do, because it will promote the capacity of designing and implementing long-term support to the professionals, and the promotion of the relevant infrastructures, because if we have this funding, it's easier, if not the only way to have it, to guarantee that we provide evidence, we provide knowledge for policy making, and as I said, it's a way of ensuring equity and even territorial cohesion. So civil society organizations can have their value, their added value, leveraged by these support, and of course can make more present and more achievable the aims that we design to guarantee, in the special case of the public health workforce, that we have the relevant standards, and we can behave when needed as a single voice. Thank you very much.
Thank you so much, Enrique. And now I call for Charlotte Marchandise, I think, from the European Public Health Association. Charlotte, EUFA unites research, practice, and policy voices. From that vantage point, what does civil society add to Europe's health ecosystem, and how does the funding affect the ability to present a united, evidence-based voice? Charlotte?
Thank you very much.
Yes, please.
Sorry.
Thank you very much.
And thank you for your invitation. We're really happy to contribute because more than anything, we think we should be united within public health, but also in collaboration with the people from environment, as you said very clearly from Hill, because when civil society organizations disappear, things go bad. So I'll take it, yes, from the science perspective, and knowing also that some people from our network, so UFA, we unite National Public Health Association, or a civil society in the country. And one of the things we need to do is empower them, because if we are having and facing threats in Europe, they are facing threats in many countries. I'm French, so it's marchandise, but I take any way of saying it. But in France, also civil society is under attack. So one of the things we need to know is what we do in Europe can be also a way to empower civil society in all the countries. And the other thing is that some of the scientific people, they're like, oh, academy is not civil society. So we need to work on the narrative, even from our crowd. And the narrative is we are indispensable. We are an essential part of Europe, democratic, scientific, and ethical infrastructure, because it's the space where actually citizens out of academy, out of the school, and that's why we work very closely with youth, with ASFER too, and policymakers can meet. And they don't have, and I've been in policymaking, we don't have so many places and moments to meet and build and innovate and react together. So we make democracy real to ensure has a passion for themselves, citizens, patients, professional expertise, scientific voices are amplified. That's why we need to unite and work together. We need to amplify, we need to repeat, because that's the way we can transform policy from top down, what's happening, to something more bottom-up and participatory, and turning the European project, which is a beautiful dream, into a lived experience for people, and not the technocrat thing people are afraid of, I think. Well, no, I don't think, so that we see from many, many surveys. Second, and it has been said, it's really hard to come after so many very true intervention, but to wrap it up, we safeguard legitimacy and accountability. And this is also why, with the cut of the civil society grants that was done unilaterally and after signing by the Commissioner Varhelyi, we want to say that we are eye and conscience of Europe, and we want to respond. That's why we went to the Ombudsman. That's why we want to use institutions and ensure and contribute to show they respect transparency, equity, and the rule of law, because it's how independence is holding the power accountable, and we need to hold the power accountable. And then, of course, we turn vision into implementation, because no bold strategy designed in Brussels will really change things if you don't have implementation. So research, education, community engagement, we connect the agenda with the practitioner. And public health practitioners are really, it's a big, big community, and it's people in schools, people in cities, people in region that actually makes it happen. We are the leaks. So for independent pan-European evidence that government can produce and can use, and of course, we run with values and we fight for equity against misinformation. And we can also show emerging threats when there are weak signal. We can put weak signal onto the political agenda. For the second question, what happens when civil society disappears? Well, we are losing huge capacity, because civil society is not only about the people who are paid and the teams of our offices. It's about, and you're here, Paolo, to show that all the volunteers, presidents, boards. In UFA, we have 30 sections, scientific sections with lots of volunteers. So when you support an NGO, you are supporting a huge work that will not be coordinated. And they are civil society organizations, there are NGOs that are in great danger of disappearing in Brussels. And that's a huge drama, because then they are fighting against commercial determinant of health, and then the commercial will win. And that's really a big problem. When civil society disappears, we lose allies. We lose cases. We lose the momentum to put evidence and to policy, but also public attention. And what happens is policy credibility erodes together. It's win-win. It's what somehow it's not understood. It's win-win for citizen trust. And well, last but not least, we have to show, and this is, I think, our responsibility now, not only to speak truth to power, and we've been doing that in Gashtan, and we've been advocating to really show the commissioner that it's a bad choice, but we have to show you how it's strategic investment and how we have impact. And I think we have to innovate all together right now to show the impact of civil society in policy briefing that can maybe understood. And last but not least, I really think we should protest more and block Brussels and just go all the civil society in front of the President von der Leyen office and make our case in a way that activism has been doing it, because public health comes from activism in the first place, and we should never forget this heritage we have. Thank you.
Thank you so much, Charlotte. Thank you. And now, last but not least, Professor Raman Bedi from the World Federation of Public Health Association. Raman, with your global perspective, how does Europe's treatment of civil society compare with other regions? And what lesson can Europe learn from context where CSO are core to national health system?
Thank you very much. I think the key point I want to deliver is that this is not a European issue. And if we consider it always as a European issue, we just isolate and we show the lack of past interlinking and developing alliances. But anyway, thank you for this opportunity. As the World Federation of Public Health Association, we represent national public health associations across the world. So we've got a unique advantage. We see what works, what fails in supporting civil society and health globally. So there's a paradox. Nations with fewer resources have learned to fund and integrate CSOs structurally. They've learned it the hard way. Meanwhile, Europe, with its vast greater resources, is moving backwards, treating CSOs as a discretionary expenditure rather than a critical infrastructure, and making mistakes that lower and middle income countries have learnt decades ago. So I just want to raise a few points. First of all, if we are going to protect the globe from the next pandemic, then we cannot treat Europe as an isolation. So we have to defend civil society for a global agenda. But there's also a global credibility. Europe has become the voice of health equity globally. But how can you advocate for strengthening civil society in Africa and Asia while simultaneously defunding your own? So how can you promote inclusive health systems abroad while cutting organizations that deliver inclusion at home? It's a contradiction, and Europe's moral authority is at stake. So the point I want to underline is this is not just a European issue. Of course, it has an impact on many who are working within Europe, but it is a global issue. What we're witnessing is a global trend. Wealthy nations are retreating from systems that deliver equity. I won't go into detail, but we've seen that in the United States, and now we're seeing, by the defunding of civil society in Europe, a similar trend. These aren't isolated decisions. They're part of a broader erosion of commitment to health equity that is precisely the moment when health equities are widening. So if Europe is a democratic stronghold and retreats from supporting health civil societies, it sends a devastating signal to other governments. The consequences have yet to be realized, but I think they, for many of us, can realize what they may mean. More instability, less peace, more migration because of turbulence in different countries. So what I would want to recommend is that maybe in the past we have not focused enough on global alliances of civil societies. And we've paralyzed them and polarized them within a North American agenda or a European agenda. But actually there's a global agenda where we can develop these networks and strengthen them, and each can come to its own and be a voice of support for each other. So the point is, without rehearsing again all the reasons why civil societies, and I think we all are in agreement, and I don't want to sing to the choir. The point I want to raise is that let's see this as a global issue, not just a European issue. Thank you.
Thank you so much, Raman. Now, just to complete the overview, I would like to introduce Professor Kjeld Hansen, member of the steering committee of WHO Civil Society Commission. We have a recorded message, please.
So I think it's important to think about how organizations work. So if you are funded in the same way like governments, funded institutions, then you tend to think alike. If you're funded in diverse ways like civil society institution, you tend to cover different angles. So civil society will go in and cover problems that are normally not covered by public institutions. Could be that they cover the same problem but in a different way. And civil society has a tendency of being able to get closer to communities because they're not seen as potentially powerful or similar, but seen as on side of the citizens. And that's why I think governments and civil society can complement each other a lot in order to create stable, resilient institutions in dealing with health problems. And on the same side, if you look at what is lost, you can say quite provokingly, you can say everything is lost because there will not be any diversity in the points made. There will not be any outreach to the same extent as with civil society. And these are the things that we know are essential in order to articulate the voice of people. And if people's voices are not articulated, then there's no universal health.
Thank you all. What comes from this talk is that civil society provides trust, reach, legitimacy, and innovation that institution alone cannot offer. When it is weakened, resilience and social cohesion are at risk. It's clear that civil society organizations are vital partners in building resilient, equitable system. To deepen that understanding, we'll now hear how our institution and policy colleagues see this same landscape. And now it's a pleasure to hand over to Peter van den Adder, representing ISDE International, who will guide us through the next segment on partner reflection.
Thank you very much, Paolo. Yes, I'm Peter van der Hazel. I'm a medical doctor by profession. I'm the past president of ISDE, also past president of HEAL, and currently still president of the International Network on Children's Health, Environment and Safety. My work has long been focused on environmental health, and I think that's an important bridge between science, policy, and society, as also your different professions are forming a bridge. And that makes also this topic for today very close to my heart. I think we have just heard the lived experience of civil society from different angles, and now we would like to hear from our institutional partners, colleagues that are shaping health governance at EU level, national or international level. Their role today is not to announce commitments, but to reflect on how they see civil society contributing to resilience and what risks they perceive if that contribution diminishes. I would like to ask first Peter Agius, who is a member from the European Parliament representing Malta. Dr. Agius, you've worked closely with NGOs in Malta across several levels of governance. What has that collaboration looked like in practice? And what do you think could be lost for both sides if this collaboration weakens? Please, the floor is yours.
Peter, if I may interfere just for a second, Peter Argius will be able to join us just somewhat later.
Okay.
So we will leave him for the end of our institutional and policy speakers. So I would say we can move on to Vesna, and then we come back to Peter. He will be able to join us at 3 o'clock.
Okay, thank you. Okay, then I would like to introduce and ask Vesna Kerstin Petric from the Ministry of Health of Slovenia to take the floor. Vesna, from a national government perspective, how do you think that civil society complements the official health action, particularly in the crisis response and prevention? We heard several examples just mentioned in the previous session. And what do you think happens to governments themselves when the civic space narrows? The floor is yours, please.
Do you hear me now?
Very well, thank you.
Oh, great. Okay, so it was just the computer, something. Okay, first of all, I have to say that, yes, I'm coming from Slovenia. I'm working for the government. I have done this for many years. I'm a medical doctor, and I have done many things in my career, but those that were successful were always done with the support of civil society. So I'm a kind of person who really does understand the strength of civil society. I would also like to share with you that I am in my government responsible for collaboration with WHO, but also for collaboration with Observatory for Health System, so research, and also I am taking part in Gastein Forum, where I am also sitting in the board as I am in Observatory. So I think I have quite a broad view and would be able to share with you how someone sitting at the government and having a little broader view sees the situation. Let me say first that I'm very fortunate because my government does understand the potential of civil society. And to prove this, my government is the government, together with Thailand, that promoted adoption of social participation resolution at the global level. And social participation is actually how the government, the civil society, and the professionals could work together in trust and move things further. And why we were doing so, it's because we don't think the civil society is only there for advocacy, reminding us what we should do at the government, nor is there only for service delivery, but we have back home and globally a lot of examples where civil society is not only an added value, but is necessity. So, for example, if we look at emergency situations, how could we respond to any emergency coming for the war crisis or climate change if we would not have civil society already organized, working hand in hand with the government? And we have, that has been proven in my country. When we had big floods, without the NGOs working in mental health, we would actually not be able to ensure support to all the people that were desperate for the mental health support at that moment. Health literacy. Who do you think will do health literacy? The health professionals? We have such problems with health professionals for those things that they should primarily do. What about health literacy? And how are we going to reach those unreachable already? Misinformation. How can we work with youth, you know, in addressing misinformation? Mission impossible if we don't include youth organizations that are there for us and willing to help. Equity and, for example, even research. How can you get the views of the most vulnerable if you don't work with civil society to bring you to those most vulnerable? Because they don't attend things just like that. You have to really get to them, and it cannot be done without civil society. And for long-term care, vaccination hesitancy listed. And in my country, we do understand this, so we financially invest in civil society. We have tenders and pay for the work they are doing.
And we are at the moment really not happy with the processes going on, in particular in European Union, where there is, not enough understanding of the not only value, but also necessity of working hand in hand with international networks, because international networks fuel our civil society organizations in the country. They bring knowledge to our people, our networks, our civil society in the countries. So we need both. We need civil society back home, but we also need international networks so that our people back home can relate to other people in other countries and share the knowledge, share good practices, and so on. So you can clearly see that we think it's a disaster not to ensure operational funding for the international networks, what is going on now. So we will oppose as much as possible and try to get it right. And when you say competition, yes, competition, I think my country is competing quite well in health, because with less resources, we get more result, in particular, because we are working for ages now with civil society. In 90s, we succeeded to have 0 examples. Actually, we did have some imported examples of HIV-infected people in the group of intravenous drug users, while Italy had 60% of infected. Why was it? Because we were actually paying NGOs to get us to the users and ensure that they were aware of why they should not exchange needles, and so on and so forth, not to go in details. So somebody says attack. Yes, there is attack, and we should know why that is. So it's important to understand that this is not attack only on civil society. This is attack on medicine. This is attack on institutions, because you should also understand that WHO is also being attacked. Medicine is being attacked. So somebody is investing, and we can suspect who it is, because there are huge financial interests behind this, that people should not trust anymore medicine, doctors, WHO, and so on. So NGOs here advocating for health policies, of course, they have a huge enemy, as everybody in health nowadays has. I think I cannot be more clear about this, and I will just go to what we could do. Response, what could we do in such situation? First of all, I think you all around this table should understand that nobody can do it alone. We should make partners with, not only among the civil society. It's good to partner with other NGOs or civil society institutions, such as those working in climate change or protecting environment and so on. But you should also partner with ministries of health, because we at ministries of health, we are also desperate, because it's a huge push privatizing health sector and so on, and we all understand what this is all about. So we need you there, and you also should partner, and it's good to know that we among here ourselves will have, or he's here already, people from the parliament. Professionals should be or are our allies. Of course, youth also. Youth is super worried. They would like to participate and work together with us for common good. They do understand common good already, and they are worried that this will be gone, so they are our allies. Researchers, there are some researchers, media, there are some media that need to be identified, and some other entities. But we should not only advocate, we should mobilize. It's good to advocate, but we need to mobilize. And how are you doing this? First of all, my country thought that we can mobilize through the resolution on social participation. That was one way of mobilizing globally. We brought it to New York with our president, Kenyan president was also there, to put it on the higher level, to talk about the necessity of having strong civil society and investing even in civil society to be even more powerful to support health sector in what we are after, because we share the values, we share the goals. And also we want WHO to identify good practices and share good practices, because how can we defend ourselves if we prove the impact, if we prove that what we do together, so the government, professionals and NGOs, that this works better than if we don't invest in this? That is a very good way of defending us, or not defending, but of sharing with people through media even that this really works and is worth investing. And then also, of course, we should publish more, we should report more on good practices, share those not only with those that are already convinced, but also take an opportunity and share it with those that are not yet convinced, not against, not having specific interests being against, but not yet convinced. So I invite you to try, all of you, get things right at the social summit in Qatar that is now the first big event, and all other events. We should be super vocal and our voice should be heard. And the only thing we have to say is that, you know, there's a lot of evidence that governments working together with civil society and professionals, this really has an impact. But for this, as I said, we still need additional evidence, and Slovenia is really pushing that WHO would have this as a priority also in the next program of work, and that we hope that also countries will have understanding and will invest in this, not just at WHO, but also at European Union. Thank you very much.
Thank you very much, being so super vocal that yourself in this matter. I would like to ask our next speaker, Michael van den Berg, representing the OECD. Michael, your work through OECD has worked through different initiatives like the Paris Project that has highlighted governance, trust, and also citizen experience as cornerstone of resilient health systems. What evidence do you see on the value of civil society participation, and what does the data suggest what happens if this is becoming absent? Could you highlight on that, please?
Thank you very much, Peter, and thanks for inviting me to this meeting. I heard a lot of wise words, and indeed, I need to be careful not to preach too much to the choir, but there is one thing that everybody, I think, understands. Like, healthcare is all about patients, and how like one patient in who we worked with at OECD said, patient benefit is the point of all healthcare. And indeed, you don't need to be an expert to understand that. But in the past decades, there have been dramatic changes in healthcare. So in the typical 20th century model was particularly curative and focused on fixing what's broken, right? An episodic type of care. Nowadays, we live in a time that people live longer, but they also live longer with chronic conditions, and often multiple chronic conditions, and they have very longitudinal relationship with healthcare, which I think makes it even much more important to have a deep understanding of what's going on in these people's life and whether our health systems are truly benefiting people using them. And I think consciously or subconsciously, there is still sort of misunderstanding that there is something like hard data. So that's the economic indicators, that's clinical data. And there is soft data, that's what people say, right? And I think this is a real misunderstanding. If we acknowledge that healthcare is all about people, we need to understand what moves people, what matters to them, and how they experience their lives. And I'm not saying we don't need these valuable clinical data and economic indicators. That's often registered by the providers of care. But if we all agree that healthcare is about people's lives, the only ones who truly know whether health systems are performing well is the people with lived experience. And you already mentioned it in your introduction. The OECD has, in the past 7-8 years, launched several important initiatives. The first one was that we developed a framework for people-centered care, and that was following our ministerial meeting in 2017, where OECD ministers agreed that this is an important lack in our health systems, that we are lacking essential information on what people are reporting, and not just about what you people are reporting, but are we systematically measuring that? Because we're measuring everything in healthcare, right? Health is a very extremely data-rich environment. We know the numbers of hospital beds and the number of doctors and the morbidity and the mortality, but systematically measuring what people report, how healthcare impacts their life, is still an exception. And then when it's done, it's very fragmented. And so we have launched this framework, and we have launched the Paris Initiative, which stands for Patient-Reported Indicator Surveys. In this project, we have launched the biggest international survey of people with chronic conditions. It's around 107,000 patients in 19 countries. And we worked closely with what we call our international patient panel, with people from many of the organizations that are here today, like YAPO, European Public Health Association, the Patient Forum, European Patient Forum, and so on. And we have learned a lot from these people, because no matter how many experts and academics and policymakers you bring together, there's a unique experience coming from these civil society organizations and patient organizations. They have, for example, learned me a lot. They taught me a lot about the use of language. What kind of language are we using when talking about uses of care? And in research, there's always the tension to only talk about vulnerable people who are suffering and need to be empowered. But what's sometimes forgotten is actually these people are bringing a unique experience. They know very well what needs to be done. They know what their objectives are, and they have a unique type of expertise that they bring to the table when talking about health policies. And we often explain also in research about populations that are hard to reach, right? The lower socioeconomic status, people who don't speak their language, and so on. And I also met some skepticism about organizations that we were working with. People say, oh, now here you're working with the professional patients with a master in public health. But these organizations have a network that is deeply rooted in the society. They know very well what's going on in this society and in the population of people with chronic conditions. So this helped us a lot in deciding, actually, are we measuring what really matters? Are we really focusing on the things that need to be measured? And you talked about governance. Well, I'm coming from an economic organization, and there are many concerns these days about fiscal sustainability and the resilience of health systems, because healthcare is continuously expanding, costs are rising, and this put a pressure on countries. And so one might think we need to be careful with giving these CSOs, the civil society, patient organizations, too much influence, because this is only going to further increase the cost and demands, right? Users of care are often implicitly portrayed as the very hungry caterpillar who will consume more and more and more care. Actually, the opposite is true. If you look at the evidence, this is really a big mistake. People want value, not volume. We have published a report called Tackling Waste. It's already some time ago, it was 2017, which estimates that around 20% of healthcare spending is effectively wasted. It shows that there are many procedures out there that are ineffective and at worst harmful. It also shows that there's a lot of administrative burden that could be organized much more efficiently. And there's a lot of fragmentations and siloed healthcare. In fact, a lot of our healthcare systems are still modeled in a way that they were in the 20th century and not well adapted to the needs of people today. And this leads to duplications, to misdiagnosis, and so on. This is where the waste goes, right? And there are very few patients out there who enjoy consuming healthcare. There are very few people who want ineffective treatments or that is potentially going to harm them, or even people who enjoy fragmentation of care. So I really want to echo the point that Frederica mentioned today. Involving CSOs, patient organization, is an investment that's going to pay off. It's going to help you focus on what really matters, focus on performance, but even it's going to pay off economically. About the trust, trust is something that we measured in our Paris survey. And the trust in healthcare providers, individual healthcare providers, is very high in most countries. In many countries, it's above 80% where people say, yes, I trust the healthcare provider who I just saw. Sometimes some countries it gets even as high as 90%. Trust in the system as a whole is a bit lower. It's just over 50%. And that will always be like that. People have more trust in people than in systems. But importantly, the trust levels gets lower when people have more complex health situations and when they have experienced a lack of quality or an adverse event, because that's also something that we measured, you see that the trust in these systems drops. So, and sometimes the elements that help them, that contribute to care, are maybe unexpected. It's not always very complicated. It's, for example, spending enough time, having enough time with people to listen to their concerns, giving them the time and the ability to have a say in the care that they receive, so the shared decision making, that is strongly related to trust. So policy that promote patient safety, a better care coordination, continuity, and so on, all have a positive link. But for this, you need to truly understand what's going on in people's life. Because if you're treating every condition as a separate condition, you're missing the bigger picture, right? You're not taking the patient as a starting point. You need to truly understand what's going on. And for this, you need these organizations, civil society, to get a deep understanding. And lastly, also the equity. We found that gaps between income groups are very persistent, and also a phenomenon that we call the gender health paradox. So women live longer, but in all the health outcomes, they score worse than men when you control for age. And I know this may not come as a surprise because it's in line with the literature that we already knew, but also here, the CSOs play an important role. It seems that our health systems today are still too much designed for men and the higher socioeconomic status groups. People with the higher incomes and higher educations, they still show much better outcomes. And we need to remind ourselves that the people who we should worry most about are often those whose voices are heard least, like Hans Kluge, that we need to reach the unreached. Well, here I will stop, but I will just repeat where I started with value over volume. For that, you need to listen to people and put people at the center of healthcare.
Thank you very much, Michael. I would like to move, also looking at the clock, to our next speaker, Maria Neira from the World Health Organization. Maria has, as WHO herself, long underlined the importance of engaging civil society in health governance. From your global vantage point, how do you think that CSO adds value for the preparedness and resilience? And what is lost when their space shrinks here in Europe, but also elsewhere? Maria, the floor is yours.
Yeah, thank you very much. And it's really a pleasure to be with all of you and to listen to the very wise and stimulating and inspiring interventions before. And nice to see you, all of you, and to see that you remain very, very much committed. That gives us a lot of hope in these difficult times and challenging times. The geopolitics today are what they are. I think we need to be very realistic, understanding that they are not in favor of science, they are not in favor of public health, they are not in favor of civil society participation, they are not in favor of a public system, particularly for health. This is the geopolitical situation at the moment. But the reality didn't change independently of the geopolitical situation we had. The reality is that more than ever, we are confronting the climate change crisis. We are confronting a pollution crisis. We are confronting a lack of engagement and now even financial resources to achieve the Sustainable Development Goals. We are more than ever challenged in all the statements we are making in terms of science and in terms of the scientific community promoting certain interventions. And this is why I think the civil society is more needed than ever. And those are my, I think, prescriptions of how we can face the situation and be very tactic, not only strategic, but very tactic on the way we will respond into this particular situation. The first is, of course, we need to keep producing science. We need to keep presenting this science and discussing this science in different fora, associations, opportunities like this one here. We need to keep motivated and engaged and maintaining as well the engagement of our troops, of our people, of those who believe on public health. But second, we need to communicate public health and the needs in terms of public health, maybe with a different tactic. Maybe keeping in mind that our target now needs to be those who are listening as well to others who might have very demagogic arguments, a little bit populistic arguments, and we need to talk to those who are not converted and those who are maybe now joining on an easier populistic and discrediting arguments that others are using. And this is the reason why we are, and you are, a civil society more needed than ever. Because we need to make sure that the civil society is convinced by civil society. Means that if we want to tackle the causes of climate change, you need to have a society convinced that they need to put pressure on their politicians to do so. So you need to talk to those who are not converted, those who are listening to others with, as I say, very easy and maybe populistic arguments, and we need to convince them as well. The day the citizens will say, I understand that the climate change is not just something for an elite, for somebody who is a Greenpeace activist or somebody who works on environmental health forever, but it's for me and will be influencing my health and having a positive result on my health. I think that it will be the day we will be going beyond all of those political decisions, and there will be such a pressure by the civil society that it will be irreversible. Third, another important role for civil society today is to talk in positive and using more and more, starting to learn and using more and more those economic and positive arguments. We need to tell our society not only that this is affecting their health, this is creating a problem for the public health communities, but there will be many positive health outcomes if we take certain decisions. And we need to use that language for our mayors, for our local municipality policymakers, for those who have the capacity to influence. And that's why your role as well as civil society has to go maybe beyond the traditional partners. Of course, we need to keep trying and talking to different networks and to different institutions, but keep in mind as well that now we need to focus mayors and then urban planners, those at the city level and municipal level. I'm sure that Charlotte doesn't need to be convinced, as many others. Those are the ones who have power on their hands to change things independently of the political party they are representing. Those are the ones who can gain votes if we improve the health of the people, and therefore we need to help them on saying, okay, we will quantify for you the health benefits you can obtain if you put in place a more sustainable public transport system. And this is the way to do it. We can put you in contact with other networks who have the experience, the knowledge, and we will be next to you to provide you those healthy arguments, the positive arguments that will help you to gain votes, and that will be maybe the best motivation for that to act. I think we have very beautiful examples around that we cannot ignore. So this positive narrative is very, very much needed at the moment. Positive in the sense that we are not hiding the reality, but we need to tell them how dramatic is the reality, but saying, however, if we do this, and that, the results can be very, very much in our favor, not only for public health, but for the economy as well, which is the argument that many people is using these days. Economy. If they want to talk about economy, we need to learn how to use the economic arguments. Even if we are by tradition more specialist on public health, these days, public health communication and economy needs to be one, because this is the only way we will maintain this commitment and engagement, and we will influence others. So, and my last point will be that don't forget that in addition to do advocacy, science, and interventions and positive narrative, legislation is important as well. I'm very, very proud of what the European Parliament, the European Commission has just approved, the directive on air quality. That can change a lot of lives in Europe and of course beyond. And we need to be there as well to demonstrate that this legislation will have a very positive impact in the health of our people. And again, use it and repeat it and use it again to motivate more and similar actions from a legislative point of view like this one. And last point is don't take anything for granted, because the times are not for taking it for granted. We need to fight more than ever, but we need to as well infiltrate as much as possible negotiations like the one on climate change, the one on plastics, the ones on the international and global ones on urban health and in cities and different urban planners. And more than ever, we need to be multi-sectorial, and more than ever, we need to learn the language of other sectors to be able to influence them. So I keep a pathologically optimistic approach because we definitely need it. And I'm really convinced that this is the time for a public health revolution, because we are more needed than ever. So thank you very much, and thanks for inviting me, and a pleasure to see all of you. Over.
Thank you very much.
Thank you.
I have been notified that Dr. Agius has arrived. Peter Agius is a member from the European Parliament representing Malta. Dr. Agius, you've worked closely with NGOs in Malta across several levels of governance. What has that collaboration looked like in practice? And what do you think could be lost for both sides if that weakens? And I would like to invite you the floor.
Thanks a lot, Peter. Thanks a lot to all of you participating, and especially the organizers. Congratulations for proposing this debate, and thank you also for all the thousands that contribute to civil society organizations across all Europe, especially in the public health sector, because your contribution enriches the debate and is actually a way of ensuring that the real issues come to the foreground of our debate. I am a member of the European Parliament, and I have strived as a member of the European Parliament. I'm a new member, just elected in last June, the June before that, sorry, a year and something. And I'm striving to make sure that the European Parliament is open to the participation, the collaboration, and the contribution of civil society organizations. In fact, as a member, I have very close collaboration with civil society organizations active, especially in the health sector, but also beyond, in all the areas that are of interest to my electorate. I come from Malta, a small member state, but which needs to be covered through its own interests and aspirations in the European Union. This I do as a member by, first of all, hosting also discussions in the European Parliament, and secondly, most importantly, actually, by representing the views of civil society organizations when they reach us through email or through meetings, because I think Europe needs to represent your views and we need to be flag bearers of your work as much as possible. Now, back to the question under debate. Yes, in Malta, I have collaborated a lot and I still collaborate very, very closely with civil society organizations. It's not an easy time. You know, a lot of NGOs, especially in Malta, are underfunded. They are basically a grouping of citizens, in a lot of cases without specific funding, without specific support. And sometimes, if they are doing something which is in line with the wishes and aspirations and the political objectives of the government of the day, they might find some sympathy. If not, they find direct opposition. And in fact, it is not an easy life to be militant in a civil society organization unless your objective is directly in sync or you make it in sync with the government's own priorities. I mean, Malta is a very polarized society, a very polarized political climate. We have only two parties in parliament. So if you are with the party in government, you have a bit of a downhill struggle. But if you are against, you will find all sorts of obstacles. I have worked in a number of areas, especially in Malta, of course, on diabetes, on cancer, for instance, on food intolerances, also recently. And you see that civil society organizations, of course, they like to be in close contact with policymakers, but of course they need to be careful on how they do their policy. And I think as policymakers, we need to strengthen civil society organizations in everything we do. First of all, by seeking their input in our policy making, both at national and European level. This cannot be tolerated that you do policy without involving those who are mostly in touch with the areas you are speaking about. And secondly, of course, by being available and considering ourselves not to be infallible. Because sometimes I think I'm meeting too many politicians who believe that they know it all. And maybe it's because I'm really so much of a beginner, or it's because I'm so ignorant in many areas. But I think sometimes we need to be much more open, and open our ears to learn more. Because infallibility maybe is also itself, I'm sorry to say, sometimes a sign of lack of knowledge, a sign of lack of awareness, a sign of if you are too sure about something, sometimes maybe because you didn't study it too well. So I think we need to make sure that our politicians are not subject to the same whims that sometimes touch people on a Facebook post who tend to write all sorts of hogwash sometimes because they know it all, and we don't know it all. We have so much to learn from people in the front line, people who are speaking to the others, speaking to the victims, speaking to the patients, speaking to the frontliners in the health sector especially. And then, of course, what we need to make sure is that we have an autonomous and independent civil society. And that is also why I trust a lot in civil society contributions in Malta, because they tend to be truly independent and not taken over by commercial interests. Because when you speak to, as an MEP, I also listen to a lot of industry voices, right? I am learning from that as well. But industry voices, of course, they speak depending on where they are sitting. So civil society organizations need to help us to bridge more with the public good. So in conclusion, I extend my availability to you and to the organizations you represent as a member in the Health Committee of the European Parliament. I have a lot of projects going on in different areas. I'm sorry I will not be able to follow all the rest of the session because I need to be in the group here in Strasbourg. I am in Strasbourg right now with the session of the European Parliament plenary. But I really commend you for this initiative, and please consider me available for a follow-up of this relationship. Thank you for now.
Thank you very much. Very clear statement from you. We are running short in time, so I'll just very briefly, well, I'm not going to summarize everything that I heard, but I learned a lot about good suggestions and understanding of the importance of civil society, and maybe the narrative about learning about caterpillars that need more value and less volume is maybe a good image of what we can take into consideration in our next steps. I would like to hand over to Milka Sokolovic, Director General of the IFA, to take us into the final dialogue. And we're going to move from risks and recognition to actions and solutions. And at the end, we will try and summarize our next steps. So the floor is yours, Milka.
Thank you very much, Peter, and thank you all for your wonderful insights so far. It seems that each of our speakers today could hold a whole webinar on this topic on their own, and it has been really beautiful to listen to all the interventions and learn a lot. I've started imagining that caterpillar turning into a butterfly, so let's dream of it. Okay, so we are all clear on the value of civil society, and it is unquestionable, as are the risks of defunding it. The question is, what do we do about it now? We have already heard quite some ideas, and I would like to focus specifically on health civil society, because I think there is a specific vulnerability to it. I think some other sectors in civil society are doing better. And maybe what Anna was saying about the attacks on the environmental civil society actually speak to that. It actually means that the environmental civil society is louder, better visible, posing more of a problem, so to say, because there is a feeling among the health civil society that the problem is that we are not seen as a problem, or we are not loud enough or visible enough to be noticed, and that invisibility maybe makes it easier to overlook us, or overlook what the loss would be if the health civil society doesn't exist. So how do we change that? How do we become enough of a problem to be taken seriously and taken as a part of the solution? So I would like us to touch upon four different issues. We are still solidly good in time, especially given the number of speakers that we have had today. So we have short of 30 minutes for this discussion. I would like us to touch in succession on the visibility of civil society, on reaching the critical mass, on securing courageous leadership, because we ask courageous leadership from our politicians. Are we courageous enough? And then how do we wrap up that strategy going forward? And we really need all views from all different sectors, both of civil society and the institutions that we have around the table. And also, please, the questions and comments from the participants are most welcome. So let's start us off with the visibility. How can civil society be more visible, more unavoidable in Europe's public health and landscape? Not as troublemakers, but really as indispensable problem solvers. And then again, not from the point of view of civil society, but from the point of view of the broader, well, of the society, be it policymakers or citizens in general. So the question is open for everyone. please, well, speakers, if you have any thoughts on how to make civil society more visible, please come forward. Charlotte, I see your movement, yes, and Vesna.
Yes, thank you. Thank you very much. And I'm sorry I'll have to leave, so but please come back to me. I just really think we need to try to begin to build common goods. We're not building enough common goods, shared goods. And one of the things we'll present in European Public Health Conference next month. And we're really happy to say we closed registration. So we have 3,000 people coming to talk about public health in Helsinki in November. So public health is relevant, I think. But how do we build common goods? And I really think there are resources, especially in time that we are all fighting for a budget that we could put together. So I'm really happy to see one thing about misinformation. I'm wrapping it up now, so you're just teasing it. We want to begin to build a shared platform to address misinformation, disinformation, and fight the commercial determinant of health in the same way they are fighting the good health messages, but in a better way. And we'd be more than happy to put resources in common, as we did with ASFER, and create things that don't belong to one of our association, but belong to all of us, and that we can really truly amplify. And I think we need some deliverable platform, website, or even shared capacity. And I'm sure we can find an innovative way to work together.
Thank you, Charlotte. I lost the very end of the answer, but I think that may have been thank you. Well, just one very quick reflection. Yes, thank you. You're most welcome with that idea. And there is, if anything is going to help us, then it is putting our forces together. Vesna, over to you.
Thank you very much. I'm speaking again of an example from my own country. What we were faced with was mistrust of professionals to civil society organizations. As I said before, it's important to understand that we share the vision and the goals. Civil society that works in health area and professionals. We do share the vision and the goals. So we should work together much better. And we realized that this is not happening. And it was not on the side of civil society because they desperately wanted to be more involved with professionals. And there was hesitation. For this reason, we invested and establish a special unit in Public Health Institute that now enables communication between civil society and public health professionals. It works like that this unit makes sure that civil society it's informed about all the developments in public health, and they also ensure training if necessary, but it also ensures that public health professionals understand that they can only implement their guidelines within certain groups of population if they work hand in hand with civil society. So even the projects that are that were before applying for resources by the professionals, now they understand that they need to ensure that, you know, the payer will see that this will also address the needs of those most vulnerable and so on, you know, so they involve civil society even in research projects. And that is how we should approach this. But I wanted to say something else because I also want to say that, you know, there was especially there is a question we were communicating here in the chat also in between, and there was a question if, you know, artificial intelligence will make even less important civil society work. Definitely not, exactly because of artificial intelligence, we need to have civil society, patient organizations, other organizations even more involved. And it is with a reason, because we have to in advance understand how artificial intelligence might or might not increase even inequalities in health and confuse, decision makers, patients, and so on. So we need to be super alert about everything that artificial intelligence might do to health of our population. And for this, we certainly need civil society on board.
Wonderful. Thank you, Vesna. Raman, over to you.
Yes, thank you, Mika, very much. Really interesting conversation this afternoon. So thank you for all this. I've heard in the past that we might want to storm the European gates and do civil disputes. Well, whether that's true, but on that idea, we need allies. And we need allies that are not often people we've spoken to. So I think we need allies from outside Europe, where all this that is happening within Europe would have direct implications on them. Or there may be advocates and for civil society involvement. So I think we should seek them out to help us within our European debate. But within Europe, a Shakespearean statement, misery makes strange bedfellows. We should seek out allies that we have not traditionally embraced. Many people in low and middle income countries would, if they were having this debate, be talking to faith communities. Faith communities make such a big impact in the healthcare sector in their setting. We should be talking to faith communities as well to help advocacy for us. I also feel that we ought to be looking at other players like industry and how they could actually come and be advocates for us. And certainly we should be looking at philanthropy and global foundations to be articulating all the things that we're saying and to say the importance of it. So what I want to leave with you is let's go and find allies within and outside Europe. Thank you.
Thank you very much, Raman. I'm getting weirder and weirder pictures here. First, we had the transformation from caterpillar to butterflies. Now, strange bedfellows are getting into the story. Let's see what Anna has to bring in. Thank you very much. I'm hearing and noting philanthropies, faith communities, industry, and also a comment from the chat, academia. We need to be all partners in this battle. Anna, over to you.
Indeed. So I'm going to add journalists here and the media. If you're looking into visibility, as this is something we've also done as environmental groups, is really spending time, investing time in explaining the situation to journalists, which then results in if you want articles that help to counter this information, because we also saw it from the other side that unfortunately, media is also very much under pressure. There's very much a pressure to write quickly articles. It's about, something that gets then really disseminated. For example, there was one article in a Dutch newspaper that repeated this disinformation about the funding of environmental NGOs, and unfortunately this article was then actually taken up in many countries, and it got a lot of media coverage at national level. And so this is why it showed to us that it's really important to speak to journalists, including at the national level very much, because it's also where these debates are happening. And then together at EU level and at national level, we can help to increase visibility on this issue.
Very fair points. Thanks a lot, Anna. Valentina, over to you.
Thank you, Milka. A lot has been already said, but I wanted to stress the fact that probably looking back probably for many years, where we have worked in silos, we have worked on our own, doing really hard work to defend the public interest. And indeed, it's time to get out of that silo and work together. I keep repeating that our organizations bring value to the world, civil society, and that's not always well understood and captured. It's not well measured. I believe that has been mentioned already. But whether other stakeholders come with value and they are paid for, we should as well, and shouldn't be questionable anymore. So I'm really conscious that we have been doing so much hard work so far, and it's still up to us to find avenues to get our work financially supported. I don't know what else we can do. Also, the other effort we are doing also through the Youth for Health Civil Society Alliance for many months and years. A lot has been said already, but I don't know if we need even more arguments. It's more about maybe convincing the wider public that is not aware of that. They give it for granted, probably. The day our voice is not heard and embedded in the health policy processes, they will see the outcomes.
Yes, thank you. Thank you, Valentina. While the other two answers are coming, so Enrique and Paolo, I see your hands up. I want to throw another couple of questions on the table, and please think about it. They're related to what Valentina was just saying, and to all the discussions before. One is, so we are in a situation of shrinking funding environment. What happens in all normal biological circumstances, the competition increases, right? And we have increased number of fish in a pond that has shrunk and turned into mud. How do we stick with each other? How do we build, collective impact and unity rather than competing for those breadcrumbs that are left? Charlotte has already partly answered this question from UFA side, but I would also like you to think about it, and let's think about it all together. And then the other thing is, if we expect support, financial support from the institutions, how do we really properly keep speaking truth to the power while surviving this resource squeeze? So we need extreme outstanding courage in these days, well, for pretty much everything. How do we support each other in becoming or remaining courageous? So these are two other questions thrown into the mix, and then over to you, Enrique.
Thank you very much, because I just would like to, it's been very exciting and very relevant. I would just like to stress that I think we need to broaden the scope of the organizations involved. And I think we should bring together, maybe because of the nature of public health, this might be a little bit biased, particularly those that are the voice of minorities and the most vulnerable. I'm thinking about what's happening with the migrants and the way we are preparing the public health workforce in general to respond to their needs and their situation. But I also think that you need to ensure a sort of a cross-fertilization among our own organizations, so that we speak, so that we finish with this silos approach, and we have a stronger voice coming together into a certain number of things that obviously we all can agree upon. And regarding what has been said about the finding in a sense, and about academia, you all know that research is also under enormous pressure and threats. There is this in many countries this sort of vested in confusion between research and innovation, immediate capacity to look for so-called useful things that we know that have nothing to do with the real usefulness of research, and especially certain types of research, and those that are probably most relevant for us as civil society organizations, that has to do with advocacy. So we need to engage into a very more than European dimension of what we are looking for, and we need to remember that we need to know, to have good evidence, to share knowledge, so that and new knowledge, so that we can be quite efficient in the way we behave. Thank you.
Thank you very much, Enrique. I would like to make a comment that is related to your position of having to look broader than just Europe. Raman was talking about the same, and Vesna was mentioning the event on social participation organized and hosted by Slovenia in New York. And it was an impressive event, I must say, and the leadership of the Slovenian president was beautiful. What I learned and what I found really surprising was how in challenging circumstances we can learn to rely on what we have in a better way. And that actually came from Kenyan president who so representing an African country that depended a lot on the financial support from the outside. Their whole health system depended on UNAID support. He was saying, yes, it was a huge loss for us, but in these circumstances, we have turned inwards and we have found ways to look for solutions, more innovative solutions, more all society solutions that will help support our health system in these new circumstances. So I think we do need that innovation and creativity. And well, some of us on this call have lived through the struggles of ex-Yugoslavia in the 90s. We also know how to look for solutions in the most difficult circumstances. So I think we need to look for, let's just say my key words from that event is innovation and creativity and really looking for own strengths in challenging circumstances. Paolo, over to you.
Thank you, Milka. I raised my hand after listening Raman, and now you are confirming what I would have liked to say. So please, we know that that many of the challenges we face, climate, inequities, migration, misinformation, are borderless. So while today focus is on Europe, we should also look ahead towards building stronger bridges with colleges, and organizations in low middle income countries, whose experience and resilience will be essential to any future collaboration. Also because, as you were saying right now, they are a source of suggestions, of inspiration, and needs. We must work with them, okay? And this is the point. And the current situation is we must look in other direction. That is the point. Okay, sorry.
Yes, wonderful. Thank you, Paolo. Fully agree. Any other thoughts on any of the questions thrown in so far? From anyone in the audience? I was checking the chat and I see that the comments have been answered. Federica, please.
Yeah, thank you, Milka. And I think I'm going to, in a sense, repeat, but also sort of deepen a little bit some of the thoughts from colleagues. I think that the question that most stay with me is how do we find courageous leadership? And I think that the courageous leadership is here and is here today. And of course, there is a lot more. There are a lot more courageous leaders out there that we don't see necessarily here on camera. But I think that the way we find courage, at least the way I find courage, is really in each other's support, is knowing that Emma, the organization, is not alone, that we are in these together. And apology if this sounds cheesy, but that's the reality of things. And I think that I fully agree in the concept that we need to break down the silos. We need to talk to each other. We need to keep talking to each other, and we need to be available for each other. And I think that when our respective organization produces so many valuable resources, and sometimes we need to build on those resources from others, but this is possible only if we keep a very open dialogue with each other. And we need also to stop looking at each other as competitors, because sometimes this concept of the competition comes from ourselves, not necessarily externally. And so if we stop looking at each other as competitors, but mostly as partners in the greater objective that is, improving the health of citizens, that's probably is going to reframe our thinking. And then here is where we can really start collaborating. And the other thing about how do we make ourselves visible, I think that we also need to recognize that, and here I will refer to the European context, but for example, the European Commission is really vocal and present in asking the feedback from civil society organization in a lot of its consultations. So the European Commission really needs the voice of civil society organization. So we are needed. We're just not able to create a critical mass to show that without us, then they don't get this feedback. So my, in a sense, very simple reaction to this is, well, let's stop responding until we reappear on the stage as the equal partner that we should be. And so I think that we do have power. We just need to find it and leverage it. That's it from me.
Thank you very much, Federica. Over to you, Vesna.
Yes, to this I just wanted to add, that we are governments, civil society, professionals, everybody that works in health at the moment is under huge pressure how to succeed with our goals. And this has been, it's obvious, and it's in all the reports, so this urgency to do something different, and Maria Neira said, revolution, we need revolution. I don't go for any revolution that is not super peaceful, for me, resolution is starting to work better together. This really is at the moment so necessary if we want to do to succeed with what we aim for. And somebody said, Africa and has so many good examples. It came out of necessity, because if they even got some international money, they didn't have professionals, so they had to involve the civil society organizations to use this money appropriately even, But I think we are at the moment all governments are feeling like that we cannot succeed somehow in health if we, and the answer very often is that we don't have even professionals that would be able to focus on how to counteract, for example, misinformation among youth, among elderly, among professionals even, So because of this necessity, I think we have a lot of chance to change the perception of working together, the government, professionals, and NGOs, and we should use this social participation resolution, which is global, for our best. We should refer to it. We should ask for its implementation everywhere, because this is the document at the moment that is speaking in this direction. So I strongly promote it, because I think that is something that can hold us together, not only in Europe, but, globally.
Fully agree. Thank you very much, Vesna. Michal and then Mariela.
Yes, thank you very much. And you won't be surprised that as a representative of an international organization, I look at it from an international perspective. And one thing we're already doing well, we are here in an international setting. And we have launched several initiatives that are already mentioned. And I worked with many countries and an international patients panel. And I was surprised by how different this still is between countries. I'm not going to do any naming and shaming here, but there are still countries where involvement of civil society or patients not so obvious, whereas I see other countries where you can't get anything done without it. And if I look in the international or research community where people are working on patient-reported outcomes and experiences, 10 years ago, we still saw tools and instruments developed without substantial involvement of end users. Nowadays, that has no credibility whatsoever. Nobody will accept that or will take that seriously if you develop a questionnaire for patients and not involving patients and asking them what matters to them. So there is a sort of cultural shift, but I would say look around you and look for best practices. There are countries like, for example, Switzerland, we're working with in Paris, where you can only get research or a study funded in the country if a committee of stakeholders, including the civil society, including patients, agree on it. Because if they don't see the point, why would we spend our money on it, right? If the stakeholders don't see it. So I think there's a lot to learn internationally. And one thing, and then I stopped. I know I'm aware that I've been promoting quite a bit our work, but there's one publication that has been published last week. I was not included in the authors. It's purely from patient organizations that are explaining how they were involved in the Paris Initiative. And I think not so much to promote Paris, but it's a good example of what Federica just mentioned, working together, right? Working together with these international patient organizations, that brings you further rather than competing.
Thank you very much, Michael, and thank you very much for pointing us to look for good practices and good examples and use them in the future. I think it's also encouraging that, unlike in the FP6 and FP7, the current research projects on the level of the European Union, so Horizon Europe, Horizon 2020 and Horizon Europe, you can also not do any research without having civil society partners and policy recommendations as part of the research. So that's a good development. Mariela, over to you.
Yeah, just 2 words. Thank you very much. It's a great meeting. I think in every area, independent work is under stronger pressure. And as everybody already said, but I think there is another point that is very concrete. Money are less at the moment. So we have to take in consideration both of them. And we have ideas, and we represent, or we are part of people. So I think ideas are always stronger than money if they are organized. So I'm sure that, I'm sure that today is a really great discussion. There is a very great discussion, but I suggest to find some way to have a stronger coordination that can continue, but a strong coordination not just in talking, but also in offering some instrument, like a platform, a joint platform, like take some position all together in speaking about poverty, speaking about independence or research, speaking about climate or the need of literature. All together, everyone with a specific expertise is much more different, or climate and the other ones is much more different than a small document by one organization. And also on the war, the consequence of wars. So I think that we have the power, but we don't use it enough. And the crisis for money today, we are not between the ones who were taking money. So I think is a very good occasion, but has to continue in the future. And the very last point, as a suggestion, education. We could have some general lecture or presentation, call as you want, very general, by organizations that are the best in this area that we have today here. And then every organization can join that first part with a specific part dedicated to its own area. For myself, the vascular, for example, but for another one is a different one. So I think to have a common instrument, also giving some small money to a common budget, I don't know, I don't have any idea, but to make a very simple but stable and disseminate project. And also information, sorry, because we are all very busy. And the OECD, for example, project is OECD, sorry, project was fantastic, but we were not in time to have a contact. So if we disseminate everything, I think we can have more. Sorry for that.
No, it's perfectly fine. There is a lot of learning, Mariella, and on so many aspects we can be better. I'm conscious of my terrible time management. I can put it on me being from the Balkans. Raman, can you have a very, very short intervention?
Very quickly. Okay, very quickly. I think we should have one action point, write to some of our global foundations, particularly in the health sector. We should say to them that what we have seen in the United States about the damage to civil society now in Europe, unless this trend is stopped, they have no chance of fulfilling their objectives and stated targets. So therefore, we should ask for an infrastructure planning grant.
Very good. Point taken. We're on it. And on that, I will conclude with just one sentence, and that is that our strength is in collective, in being together, in being seen, in being united, and courageous enough to keep pushing this agenda. And with that, I now pass the hot potato to Peter to close us in time. Peter.
Thank you very much. Yeah, I think we have heard a lot of things that we all agree upon, and I have a whole list of topics and items that I could try and summarize everything. But I think the main thing is that I think we're all on the same line, that we can't do it alone. We have to work together. That's both on the active side of doing things, but also on education. One thing I thought of is we're always facing a much bigger lobbying group in Brussels when it's about all the content level issues. But we are together also as a big group. And although we don't go there jointly, but I think we could still, if each time that we are doing some lobbying, that we could mention the civil society as a whole by saying, okay, I'm just one piece of the whole machinery, but there are other ones, and we really try to stress that we are much bigger and much wider across all different kinds of civil society organizations and representing citizens than some of the corporate lobbyists in Brussels. What I also picked up is that we have to include the financial benefits much more. And I know it's not our hobby usually to talk about finances, but we are depending on it. And we are also maybe not that much equipped. Maybe there are some of us that are really equipped in looking at financial issues. So maybe we could benefit from the knowledge that they are having, so that we can make much more clear what the financial benefits are in society. I heard something about activism, about what can we do. I'm not an expert on it, but what are the mechanisms if we collect 500,000 signatures and send it to the European Parliament? Can you try and force some kind of amendment, or can you do something when you really have a big community that is addressing itself towards the European Parliament or maybe the Commission? So maybe that's just an idea that somebody can work on. what I also think is important here, that we have to aim for sometimes for bigger institute, bigger levels, UN or whatever. I heard the global way, the global approach. So that's maybe also a way how we can strengthen forward. And I also had wrote down, and that reflects what Marielle was just saying. I wrote down as a kind of task force. Maybe we can start a kind of task force among ourselves that is doing and looking at how to share knowledge, how to share some work, how to make these financial issues more easily accessible to talk and to use. So maybe the organizers here, Paul and Milka and some others, that maybe are willing to see if we can find or build some kind of task force that can take some steps more into the future. And maybe the caterpillar might be a nice symbol for that. Yeah, be super vocal. That's also what Vesna said. I think that's we can also learn from each other and see how we can make ourselves more visible, and either through AI, what I see in the chat, or just as way, well, a simple example. I've been sometimes reviewing EU projects as a reviewer of new projects or projects ongoing. And I think each of us that is sometimes in that process, it relates to science, of course, then you can say, okay, I like this proposal, but I really would like to have a civil society organization there on board as well. Make them partners in those kind of bigger projects that are ongoing in Europe. And I think we can play a role in there by stressing that, don't forget us, take some organizations on board as well. Yeah, I stop because we are over time and we're losing people, I see, in the numbers of participants. So I would like to say, yes, on behalf of ISDE and IFA, that we would like to thank the speakers and all the participants. I heard nice reflecting words back from you about our initiative to talk about this. And as I said, to keep this alive within Europe, but also in globally, we must protect civic space, protecting public health, and we have to join forces to make things go in the good direction, and to find ourselves in the space in the near future where we are smiling that we have been doing this for everybody, for all the people in the world. So I thank you very much, and we close here. But thank you very much for your participation, and the work will continue. So thank you.